Hello, my name is Carlos Torres and I'm an STC nursing student. Today I'm going to demonstrate proper hand hygiene and donning and doffing of PPE. And this is going to be the gown, a face mask, a face shield, and some gloves. So I'm going to start off by saying the concept of preventing cross-contamination in the workplace, like in the hospital or in anywhere that you're going to be working as a nurse, is to prevent or to break the chain of infection. Okay, and there's two different types of asepsis, and there's medical asepsis and surgical asepsis. Medical is to reduce the number and transfer of pathogens, and this surgical, which is sterile, is to keep areas and objects free from microorganisms. Okay, so let's go ahead and follow me over here. We're going to start off with demonstrating proper hand hygiene. Okay, so I'm going to turn on the water first. Okay, so I'm turning both of them on because I want to keep it at a warm temperature. All right, so I'm going to wipe my hands first. Okay, and I'm going to make sure my hands are below my elbows. Okay. Making sure they're nice and wet. So now we're going to come over here and get some soap. Okay. So I'm going to start using friction to lather up my hands. I want to get in between my fingers and also under my nails. Make sure you get every nail. Okay. I also want to go about an inch above my hands up to my wrists. And you want to wash your hands for at least 20 seconds. Okay. So now I'm going to go ahead and rinse my hands. And I'm going to do this by letting the water run down to my fingertips in both hands. Okay, so the sink is considered contaminated. So I am going to first dry my hands from the fingertips up to my wrists. Okay, that's one. I'm gonna throw that away. I'm gonna get another one. Do my other hand, fingertips up to my wrists. Okay, now that they're dry, I'm gonna get another paper towel to shut off the sink. Okay, and that's hand hygiene. So now that my hands are clean, I'm going to go ahead and demonstrate how to don on PPE. So we have here a gown, face mask, some gloves, and under here I have a face shield. So I'm going to first start off by putting on my gown. So I want to put it over my head, pull here. Okay. My hands through here. Here there's some little holes here for your thumbs. Put your thumbs in. And I'm going to tie it behind my back. Okay. So now that I have my gown on, I'm going to go ahead and put on my face mask. Okay. Pinch at the nose. Okay, now that I have my mask on, I'm going to go ahead and put on my face shield. Okay, now that I have my face shield, the last item that I will put on, last PPE, will be my gloves. So here, your gloves should go covering your gown above your wrists. And now I'm ready to perform a procedure on my patient. Okay, now that I have my PPE on, now I'm going to demonstrate how to properly remove your PPE. Okay, so you start off removing your gloves. So I want to pinch at the wrist of my glove. Make sure you don't get your gown. You want to remove away. And with your other hand, you want to crumble up the glove. And then with your free hand, ungloved hand, you want to go under your wrist and away. And we can go ahead and discard this, drawing it away. Now that I have my gloves off, I can go ahead and untie my gown. Okay, now that my gown is untied, I'm going to go ahead and remove my face shield. After my face shield, I will remove my mask. And after removing my mask, you want to take out your gown by putting your hand in. And then with your hand inside your gown, you want to pinch your other hand. And you want to go ahead and take it out. Now using the back side, you want to go ahead and just go ahead and crumble it up. And that's how you properly don on and doff PPE and also hand hygiene. Thank you.